Thanks for the introduction. So I'll just quickly go through what is happening in the current scenario when it comes to Omicron. Why is there so much hype about this, and what is actually the scenario? I'll just tell in brief for the next 10-15 minutes. I'll just recap about how is it different from the previous two waves, and are we still having the older virus still lingering on? I'm sure most of you must have realized that we have been having very low numbers over the past 6 months. Over the past, I would say, since August, we've been having a lull in the number of cases, which was good. But only lately, in the last 2 weeks or so, we've had almost about 50 times the normal baseline figures from last month, the number of cases of COVID. And the good thing about this particular variant is that it does not cause severe illness, and there are not many admissions. But it is too early to say, because we have only got the Omicron into the country about 2-3 weeks ago, and the numbers are not too high. Because of the infectivity of this particular variant, we are more concerned. Now, one school of thought is that it is so infectious that almost the whole population can be infected, and the virus will go out of the universe rather in the next month or so. That is how the predictions are. So when it comes to the symptoms that are going on with the Omicron variant, we have seen that the regular symptoms like very high fevers and the cough is not a very significant symptom. Neither the loss of smell, loss of taste are not very common with Omicron. But the sore throat, the headache, the body pains, the body aches and pains have been very consistent. And some of them do have the respiratory symptoms like the cold, significant runny nose, significant blocked nose, and a dry cough like the normal regular viruses. Now, are we prone to the virus? If we are vaccinated, yes, we are still prone to the virus, because there's quite a significant mutation. There are quite significant mutations, about 15 to 30 of them, on the spike protein, which is the important attachment protein of the virus. So when there is a significant deviation in the protein makeup, the structural makeup of the virus, and it actually dodges the immune system. When there are blocking antibodies from your vaccinations, which are actually trying to prevent the virus, this virus, due to its different structure, goes and attaches despite having the antibodies, because it has a different structure this time. So that is what is meant by the mutations on the spike protein and all that. Now, how do we identify this virus? Now, the virus, what they have been doing over the past 1 year, 1.5 years, is that they have been doing 3 genes: the RDP, the N gene, and the spike gene or S gene. So the spike protein gene, the S gene, will not be picked up if it is Omicron, because there is mutation in that, and the test kits or the RT-PCR kits do not sense that particular spike which was there in the Delta variant or the Alpha variants. So that is one thing that makes us think or suspect that it could be Omicron. The absence of the S protein gene picked up on the test, while the other two genes, which are the core protein genes, are picked up. The S protein, the S spike protein gene being absent is one indication that it could be Omicron. The good part about the Omicron is that even with the Delta, for that matter, the Delta that happened in the month of April and May, where we saw a very high mortality and morbidity, very many significant number of people getting sick and getting admitted to hospitals. Now that virus, for some reason, it had subdued in its activity. The virulence of the virus has gone down, and we have seen that most of the patients who had come, there was one of these one odd patient who was walking in with the virus over the last 3 to 4 months, and we had seen that they were having some very mild symptoms, and most of them did not require admission. But we did have admissions in a few of them, most of them unvaccinated, and they were all the Delta variants, which happened until last month. Now this month, although we didn't have much of Omicron, there is still a Delta variant, the subdued Delta variant going on. Most of the patients that have been admitted have been people who have not been vaccinated and who have the same sort of risk factors for severe illness like immunosuppression and diabetes, for that matter, and obesity. So these three things actually predisposed to getting a severe COVID illness. People who are on chemotherapy, people who have had a very bad structural lung, who have had heart failure, or had kidney failures, are prone to COVID, as you all know. The treatment part of the virus has changed a lot compared to what we knew about a year and a half ago. The treatment that was there at that point in time have all been revised, and most of them have been shown to be ineffective. And there are quite a few of them which are still effective, like the steroids in the later half of the disease, in the inflammatory part of the disease, not in the early stages of the viral infection, because it has been proved beyond doubt that if you take steroids in the first 5 to 7 days, or in the initial viremic phase, or where the virus is very active, leads to a very disastrous effect. So steroids should not be used in the first 5 days, is what we all recommend. And if at all we see an inflammatory phase, which means the second phase of the illness, where the first 5 days you have the virus dividing and invading the body, and then after that it sets off what we call a cytokine storm or inflammatory response, wherein the steroids come into the picture. And it also depends on who we should target with steroids. We should not give steroids for people with a mild illness who are not requiring oxygen. So there are quite a few contraindications rather for steroids. The other very important medication that had stood the test of time over the past couple of years is the tocilizumab, which is like a medication still useful in severe illness. We only use that in people who have been admitted to ICUs, who are deteriorating, who are requiring more and more oxygen. So that is a reserved drug. The other important medication, the remdesivir, we are still not sure. There are the positives and the negatives to it. More negative in the sense it has not been proven to be a very valuable drug as they used to think before. The other new drugs that have come is the antibody cocktail, which is the casirivimab and indivimab, which and along with that medication which is available now is not very useful for the present Omicron variant. So it does not block the virus. So the people who have the Omicron Covid will not respond to the antibody cocktail, which is expensive. So if at all we have to give the antibody cocktail, it is best given within the 24 to 48 hours of the onset of symptoms. So people do give till the 5th day and the 10th day, but it is very effective when it is given very early on in the stage of the viral illness. So I would preferably say 24 to 72 hours, which is ideal. And the other important drug which has, I think, come into the pharmacies in India now is the molnupiravir, which the ICMR today says that use it with caution. So if you have a mild to mild illness, I would rather not use any medication. That would be my strategy after these 2 years of studying COVID very closely. I would suggest if you have a very small sniffle and a small runny nose, a minimal sore throat, a minimal cough with a normal saturation and not significant or very mild fever, I would still stick to the routine cold medications that you take, that like the cetirizines, like the antihistamines, which are very commonly available for even the common cold. So you need not worry too much into all this because this is just like any other virus, but with a word of caution, because the virus can suddenly change the course in susceptible individuals, in susceptible patients. So people who have risk factors, you have to be watchful of symptoms from the 5th to the 15th day. So we would still expect people to watch out for a worsening cough, a very high persistent temperature, increasing cough, decreasing saturation or oxygen, or on exercise or rest, and breathlessness on exertion. So these are the few things which we commonly tell patients to watch out for, because it's the first 2 days you have a body ache and pain, you just ignore it, thinking that it is just a normal regular virus. But at this point in time, when the COVID is still around, I wouldn't even ignore any body ache or a pain or a headache or a sore throat for that matter. And please do not brush it aside as being a normal regular cold. So this may be still the Omicron, because it has also the milder symptoms like the common cold. So I would suggest, for the sake of preventing others from getting infected, please do isolate yourself. You will only be isolating yourself if you have an index of suspicion that you have the COVID, so that you can test for it in the first place. So with that, I think I'll stop here and take questions if there are any, because I'm sure you will have a lot of questions.
Yeah.
So what is the oxygen level up to which we need to not worry? So what I would suggest is anything less than 96 is something which you will have to be careful and monitoring. After below which you will have to monitor, but anything less than 92 is worrying. So you wouldn't want to wait till 92 happens. That's what I keep telling my patients. Watch for anything less than 96, 95 and below is something which you have to think about, because something has started in the body, in the lungs. So you need to watch for any further deterioration. So that's the first clue.
All right. Dr. Gushank is asking, how dangerous is the COVID variant for 2 to 5 years of child?
Yeah, so I forgot to mention about the pediatric population. The children get infected very commonly because of obvious reasons, and that is the biggest risk that we had when the school started, and when they obviously do not maintain social distancing and they pick up the virus. The best part about the children is that they don't get it in a severe form. The reason being they have a very protective gland called the thymus, which until the age of 19 to 20, it has a very good immune response towards this the viruses, especially the COVID. Now, there are children who have been affected badly, but there's a very minority of them actually. They have the inflammatory response, which gets controlled with the regular steroids and the treatment, but we do not see very severe disease with children. They normally have a cold, a sore throat, a cough, a high fever, but they're still active, which is a good thing. So I think if it is the 2 to 5 year old, I would expect the parents to look for an active child. If the child is as active as before, just if you have a fever, you give paracetamol. If the child is back to normal, I would say that is normal activity. If the child is listless, not very responsive, and very dull, I would say that child needs attention. So if the child is as active as he can or she can be, I would say please do not bother.
All right. Shreya is asking, what was the name of the drug that can be given during the early days, and what does the CT value indicate?
Yeah. Now the drug that can be given, there are two medications that have been which they have come into the market with some scientific basis. This is molnupiravir, which is a 200 milligram tablet. You will have to take 800 milligrams in the morning, which is 4 capsules in the morning and 4 capsules in the night for 5 days. And it is best with any antiviral medication, best effective in the first 1 or 2 days. So if you take it after 5 days of illness, already the virus is inside, it may not give you much benefit. So it is more effective within the first 24 to 48 hours. And the other question about the CT value, the cycle threshold, what it exactly means is whenever you have a viral load which is very small and there is not much virus in the body, the test is run in cycles. They run in about 30 cycles, 35 cycles. So it takes them 30 to 35 cycles or 35 cycles and above to say that there is no virus. So if they get the virus, they pick up the virus with less number of cycles, like say 17 cycles, that means the viral load is high. That means the virus is significant in number. So that is what it means. The cycle threshold. If the cycle threshold is higher, that means the virus load is lower. If the cycle threshold is lower, so let us say 16, 17, that means the viral load is higher. Now, this has got nothing to do with the severity of the illness. People may have a cycle threshold of 16, 18, but still get away with a minor symptom. It all revolves around the patient's immune system as well as the virus. Now, there are people who have had a very high cycle threshold, a very small viral load as per the test, but still had a severe illness, who had to be even ventilated for that matter. So please do not go by the CT value. I keep coming across people asking questions about it looks like I have a very significant viral load. Do you suggest anything? I always say one thing, you please go by your symptoms, not by the lab value.
All right. Preeti is asking, should organizations stock up any medicines to help their employees?
I'm not sure if you should do that, because the second wave, it was really a very sad number that we saw, and that was a very severe illness. And it was not about lack of medications, it was about the severity of the illness, and also because of the complications of the illness, because they had a lot of fungal infections after the virus itself, which was not there in the first wave. So what are you going to stock with? You're not going to stock the antiviral medications, which are probably not very, very effective as it was once thought. So the remdesivir role is also questionable. So I think there is nothing to really stock.
Okay. Thank you, doctor. I hope we have already covered the next question from Sri Kala for oxygen level. We'll go ahead with the next question. That's from Shay. So they say that me and my parents are COVID-19 positive, but how do we know that we are also Omicron positive? The doctor is not asking us to test more.
Yeah, so you might have realized that there are only 2 genes that must have been tested when they have tested. There are a few labs which do the triple gene. So you please go for the triple gene, which also contains the spike protein. If your spike protein gene is negative, that means there is a chance that it could be Omicron. For a definitive diagnosis, the lab will send all the negative spike protein COVID samples for genome testing. That is when we get the numbers of Omicron in the country. So it is mandated for each and every lab to have a triple testing now, or every COVID sample should be going for a genomic sequencing. That is what is, I think, mandated now. Now, the ideal way with the current setup is to go for the triple gene testing, including the spike protein or the S gene. So if the S gene is negative, we presume it is Omicron.
All right. The next question is from Flavia. Is it advisable to do RT-PCR if there are slight symptoms?
Yes, for the reasons of infectivity. You probably will not know whether you have COVID, and at the same time, if you can isolate yourself, the disease burden in the society will come down. I think it is ideal to go for the testing if you feel that you have COVID-like symptoms. So if you have a cold or a sore throat, at this point in time, it's COVID unless proved otherwise. So I would test for COVID. And if you're positive, you would want to isolate yourself and not infect others. So at least for reasons of isolation and not infecting your family members, I would advise you get tested.
All right. Karamveer is asking, I'm suffering from last 3 days. I have slight diarrhea and body pain. Am I suffering from Omicron?
Diarrhea has not been a very specific symptom of Omicron, but having said that, when you have a sore throat, you have a cold, you have a diarrhea, that is how a respiratory virus presents. So it could be anyone's guess. It could be your normal regular adenovirus, your rhinovirus, or your coronavirus or the COVID, non-COVID coronavirus also. So you never know. If you have a diarrhea, if you have a runny nose, you will have to, at this point in time, test for COVID to make sure it is not COVID.
Okay. Ram is asking, does COVID Omicron spread through handshakes, and also is it an airborne variant?
It does spread through fomites, handshakes, towels, and everything that comes out of your body fluids. It is airborne, definitely. It is a respiratory droplet infection predominantly, but it is definitely spread through fomites as well. So you will have to wash your hands and take the necessary precautions by covering yourself and maintaining the distance, as it is predominantly an airborne infection or a droplet infection.
Abhinav is asking, is it okay to self-medicate with vitamin C, D, and multivitamins? If yes, can you suggest the dosage for adults?
So there hasn't been much of evidence for all these vitamin supplements. And let me also at this point tell you that there's been one lady who came in this afternoon who had been taking hot water and steam inhalation and all sorts of things for her normal regular cold, and then she has a severe gastritis. Now this concept of drinking hot water has never worked over the past 2 years that we had seen. So the warm water or the hot water drinking is not indicated, or rather detrimental, because you can have a severe gastric problem. And the question you asked me was about the vitamins. The vitamins like vitamin supplements like vitamin C, very high doses of vitamin C. Some people have found it useful, but it has not been validated in larger studies or data. So the vitamin C, we don't have a dose. And the vitamin zinc, the zinc actually irritates the stomach. So zinc, the 50 milligram zinc that is taken usually, it actually was thought in the second variant, it actually aggravated the chances of a fungal infection like mucor, because zinc acts as a catalyst in a fungal infection. So it was thought that the zinc was aggravating the mucor infections or the black fungus infections during the second wave. So I would actually suggest not to take any supplements. Just keep yourself hydrated and and take necessary precautions not to infect others. Just take your paracetamol. If things are getting out of control, like having a worsening cough or breathlessness or a decreased saturation after 5 days, please see a doctor.
Okay. SN Mohan is asking, is remdesivir still recommended for Omicron treatment?
As a general rule, the remdesivir was very well studied, and it is still given as a first-line drug for Omicron, because we still do not know. It's too early to say whether the remdesivir is effective against the Omicron. As a rule, as a general principle, we give this antiviral medication because it has been proven in the first peak of COVID.
The next question is from Shreya. So, my father has tested positive and has CT value of 22. He is being given vitamin C, B complex, multivitamins, azithrol, levoctrizine. Should I discontinue giving him azithrol and levoctrizine? He has fever, cough, and cold.
So the levoctrizine, that the antihistamine that you're taking, can be continued because he has a cough. You can take any cough syrup over the counter as long as he does not have a low saturation or an oxygen. And I think I probably would skip all the rest of it, because the antibiotic, the azithromycin, does not have any effect on the COVID.
Rana is asking, I need information about the booster shot, third vaccine. Please throw some light on the same.
The third vaccine, the booster, if you've already had COVID and you had two vaccines, and the infection itself is a booster, so I won't suggest the third one, the booster, the actual booster, because you already had COVID and then you have two vaccines, then it is already a booster. If you have not had COVID, you had only two vaccinations, the booster may or may not help, because there is no role for the booster in the present Omicron. But what is now believed is that the antibodies that is blocked with the vaccine have not been proven to be preventive for the Omicron. So it only tells you that the booster also may not help. Now, why is a booster required? It is just to increase your memory, because if you have read a chapter once and then you read another time after a month, you might want to read it after 6 months to recap everything, isn't it? So likewise, your body also has a memory of these viruses, which your vaccine tries to stimulate it. So you're having a memory of this virus again and again, because this is a very short-lived antibody generating vaccine. So every time you need a booster, possibly, we don't know, it may be 6 months, it may be 9 months. We are not sure about when a booster has to be given. But because the Omicron has set in, or the third wave has set in, people across the world have believed that a booster is required. But I think it's too early to say whether the booster has a role in prevention of the Omicron.
Okay. Sagar is asking, my family is currently infected with a viral and are under medication since last 5 to 7 days. Most of them have recovered, but they have not been able to get rid of sore throat and coughing. Could these be the symptoms of Omicron?
Very likely. I think people who still have the symptoms, I think you need to get tested, because sometimes it goes out of the system after 7 days and you might be falsely negative. But whoever has had persistent symptoms, I think it's worthwhile testing them.
Shola is asking if a person is COVID recovered and he's infected by Omicron, so how severe will it be affected?
We have not had much of data on this. So what I look at, how I look at, is people who have had COVID have a very different type of immune mechanisms against a repeat infection. Over the past 2 years, our experience is people who have had COVID once, a severe form of COVID, have, although they have got a COVID the second time, they have not been hit hard. So we don't know the mechanisms, but we can be assured, I think, the second infection may not be that severe.
Mala says, hello doctor, please suggest the type of mask to be worn to avoid infection effectively.
Now, I wear 3 masks, so it does not mean that you will all wear 3 masks. But ideally, I would say 1 cloth mask and a surgical mask would suffice if you're going into the general, if you're just maintaining some distance. If you're going into crowds or a very closed space, I would suggest you take the N95 because of the infectivity with which this virus is going. The virus infectivity is quite bad. So I would suggest an N95 in this current third wave. Because previously we never used to wear N95s for prevention. Even a surgical mask would have sufficed. But I think this time it's quite different.
Dr. Shivank asks, what are the best practices for air travel from a medical perspective?
Air travel for
I think he means the precautions to be taken while traveling. Yeah.
I think you need to, if you're going on a long haul flight, I'm not sure if you can do away without a meal and everything. But if possible, if you can just put your N95, because most of the aircrafts are all, they only screen for patients or people who are negative and only allow people who have got a negative test. You're relatively safe during air travel, but I would suggest you put on your N95 mask while you travel.
The next question is from Afreen. Afreen, I believe that the second segment of your question has already been answered. I'll cover the first segment, that why are vaccinated people getting affected?
As I mentioned, the antibodies produced from the vaccines that have been given are not blocking antibodies for the Omicron. So the current Omicron variant has multiple mutations. They have multiple mutations. So that is the reason it evades the regular immune protection given by the normal vaccines. If the body antibodies that are blocking antibodies are there, and then you have, let us say, the alpha virus or the delta variant, you will be protected. But if there is a mutation in the new variants, you will not be protected because your virus evades through all that and then escapes that and then goes and attaches to your body. So that is the reason you will be having, despite having been vaccinated, you may have an infection still.
Okay. Dr. Abhinav asks that he's having severe body ache since past 3 days. He doesn't have more symptoms apart from that. So should he still get tested? And the saturation is above 97 and no fever is observed yet.
It all depends on what the body pains are due to. See, the body pains have been coming up as a very major symptom in this present third wave. Without a fever, it is a bit unusual. Without a respiratory symptom, it is a bit unusual. I wouldn't really jump into testing yourself for COVID at this point because the testing centers themselves can spread COVID.
Vinny asks, I have bad sore throat and pain in throat while eating anything. I did not travel from past 15 days or went outside. So are these still the symptoms of Omicron? Basically the bad throat pain.
Unlikely, unless you have maids or someone who's coming in, you've not been exposed to anyone for that matter, which is a bit unusual. Even if you had gone for a shopping for a day or just an hour also, I think it's sufficient for Omicron to come in. But bad sore throat can be a sign of anything like the allergic pharyngitis. Also, if you have had a history of allergies in the past, I would attribute that to the allergy. But if you've been exposed to someone lately, I would test myself. I would test yourself.
Rajneesh asks, in case I am positive but asymptomatic and hence not aware, and I take a booster, is there any harm?
This concept of you might get COVID when you have a vaccine is something to do with the immune status of the person. If you're asymptomatic, you're asymptomatic, that's all. You are unlikely to get it. If you're tested positive, you've taken a vaccine, there is nothing else you can do. If you're asymptomatic, that's the end of the story.
Aarti asks, what will happen if an unvaccinated person gets infected with Omicron? Will it have more of serious effects on his or her body?
We're not sure yet, but what we have known from what happened in the Western world lately over the last month is that the unvaccinated people are also escaping this Omicron with mild symptoms. So it doesn't look like it's going to be severe even in the unvaccinated, but definitely there is a Delta variant also going around along with the Omicron, which has had significant effect in the vaccine naive people.
Kanu Chandran asks, hi, I am a marathoner. Can I go for a run with precautionary measures? I live with my parents who are 65 above age.
I'm not sure if you should do it in the next month or so, because you're very close. You're in very, very close distance when you're running a marathon or any run for that matter. So there's a very high risk of a respiratory droplet infection between people who are running. If you're running on your own, there's no reason why you should not go for a run. But if you're running a marathon or a run or a 5K or a 10K, I would suggest you hold them off for the next month or so. Like you avoid congregations or any events or anything. The marathon is also considered a similar event.
Ankisha asks, if a person is COVID recovered and still experiencing foul smell in some food items, perfumes, how much time will it take to get the normal smell back and what he must do to recover from it?
Now, foul smell is a smell. So I wouldn't really consider that as a lack of smell. So I would suggest the person to see an ENT doctor, because there is something else going on here. So I won't really consider that as a post-COVID complication because the foul smell can be due to excess mucus in the nose. So I think a bit of nasal wash also can help in these kind of patients, these kind of people. But an ENT surgeon, I think, would be able to help you better. But what I would suggest you do now is there is a nasal wash, the nasal saline wash. I'm not sure about I think it's Sol Spray, SOLESPRE. SOLSPRE. It's a nasal wash. You can just wash your nostrils, both sides, so that your nose gets clear, and then your smell can come back to normal. If you have a lesser smell than usual, it may take a while to come back. But if you have a bad smell, then you have a smell.
All right. Alden asks, my sister is 7 to 8 months pregnant. Would it be advisable for her to take the COVID vaccine?
Yes. COVID vaccines are now safe in pregnancy, as we are told. So it is advisable to take the vaccine for whatever it is worth, whether it prevents from the Omicron or not. For any pregnant woman, I think it is mandated, and they need to take the vaccine.
Ritvik asks, how long will this wave of COVID going to last, considering this variant is less harmful compared to the last variants?
1 month, I think. But it looks like what we're looking at is a month or two. The peak may be in the next 3 weeks. I think the peak will be in the next 3 weeks. This is how rapidly it is spreading. So by the mid or the end of Jan, or the 3rd or the 4th week of Jan, you will be having quite a number of patients who are infected. And it is also expected expected to die down by the end of next month. So, which is really optimistic if you look at it, because it looks like everyone is going to get infected in some way or the other, and the virus dies down, and that may be the end of the pandemic. That is how the pandemics end usually. The history says that, at least.
All right. I'll see if we can cover some questions from the section here. Which is Mahindra asks, which is the age group that is more vulnerable to Omicron?
I think it is the children, because they get infected more because of lack of distancing and all that. I think it is the children, because we still don't know the proportion of people of the age groups. We've not got data still as to what age group is more susceptible, but it looks like the children get more infected because of the infectivity of the virus.
One person is asking, is there a chance of more variants coming up in the next few months?
We're really not sure, because as we speak, there may be multiple variants going on in the community. So as the Omicron came in, and then you had another IHU or one variant from France, which has been reported. So you never know unless you test all these variants of concern. When they do these tests in the virology labs, they may or may not pick up. Because now that we have numbers, we might know whether there are any more variants. Because I'm sure the virologists are on the job. These viruses tend to mutate every so often. So that's the reason we are having all these mutant viruses. That's why when you have a common cold, why do people have common or cold every winter when they are affected with the virus? Although they have had an infection in the past for some rhinovirus or something. It's just a different virus with a different antigen capacity. So it has a different property. So that is new to the body. So that's why next year also you have a virus. So that is what is explained by a variant here in COVID as well. So if you had a COVID last year, can I have a COVID this year? Yes, you can, because your COVID last year had raised antibodies only to that particular variant, not to the variant that comes in later on in life.
All right. To our audience, we'll take up the last 2-3 questions from the doctor. So SN Mohan asks, does Omicron infected person is more prone mycosis infection?
Mucormycosis.
Yeah.
I think it's too early to say that, because even the first wave we did not have much mucor, and now that people are more I would say knowledgeable about the side effects or the effect of the COVID itself, the usage of steroids have gone down drastically, because we know the disease better now. People are also very observant about what they're taking, and the doctors are also prescribing lesser steroids in the first week, so which is good. So people who have had inadvertent doses of steroids, higher doses of steroids, had that mucormycosis, but not in this particular third wave that we had seen. We have not seen any mucor until date. So not many numbers as on today, but we never know, because COVID by itself has a tendency to destroy tissues. It has a tendency to destroy tissues where fungus has a tendency to grow up in the destroyed tissues, coupled by your immune suppression by steroids. So when these three happen, there is a small chance that the mucor might come. But I have a feeling that it may not be as bad as the second wave, where there was so many other factors which had impacted a higher mucormycosis.
Dr. Archana asks, what is the main symptom of Omicron?
I think there is no one thing called main symptom, but it looks like it's a runny nose, blocked nose, body pains, and a headache, body pains, and a runny nose and a blocked nose.
All right. Thank you, doctor. The last question is, maybe it can come from me, and this is my personal question. So, does it matter if anyone is vaccinated with Covishield or Covaxin? Is there any chance for a particular vaccinated person? Does it depend on the vaccine if they're likely to suffer from Omicron? If, let's say, if someone is vaccinated with Covaxin, so they will have lesser chances or something. So, yeah.
No. All these vaccines that have been invented only had that basic, the previous, say, seed. So it was only based on that particular virus or the RNA or the dead virus that they prepared these vaccines. If you have to have protection, ongoing protection, you have to develop a new seed which contains all these mutations, and then make it into a genetically modified vaccine. So it doesn't matter whether you had a Covishield or a Covaxin, you're at the same risk of having Omicron. So I think it doesn't really matter whether, and even the booster, people ask questions about whether if you have taken one, is it worthwhile taking another, a different type of vaccine? it doesn't really matter. It doesn't really protect. That's what I say.